Hello.
Hi, everyone.
Happy cold
Hello, everyone.
Friday, everyone.
Happy
I know.
cold Friday.
Yeah.
And happy birthday to Beth today.
Yay!
Today.
Happy birthday. I hope you're
Thank
getting
you.
spoiled.
I hope so too. I don't know.
That's great.
It'll be a good day. Yeah, I'm happy to be here. It's like a birthday gift.
I was going to say thanks for being with us today on your birthday.
Oh,
We love
it's
having you here with us.
it's the best. I just can't imagine, I get to be with my friends and get to be together with so many dental hygienists as a community. That is a gift to me for sure.
And we have a huge number of people that have signed up for this one live, which is pretty exciting. And obviously it's with our lovely friend, Louise. So I'm so excited to hear what she has to say. But definitely this seems like a really important topic. So I am so happy that you put the time into getting this together for us today, Louise.
Oh, thank you. Well, it is an important topic because it affects us all. And how we use this information may change somebody's life out there.
100%.
For sure. Well, I think we should get started. Kathleen, before you introduce our lovely guest, who really doesn't need an introduction, just obviously some housekeeping off of the bat here. Same as usual, if you have a question, we have a full program today, but with whatever time we have at the end, if you don't mind questions, put them into that Q&A. You'll see them for most of us at the bottom of your screen. If you're just saying hello or just have a comment, feel free to use the chat, but just know that any questions that are put into that chat group can kind of get lost as people kind of communicate with us. So anything you're looking for an answer, please use that chat or the Q&A. There is a raise hand function, but we won't be taking up live questions that way. So just stick with the Q&A. If at any point you have to leave, if you have little ones at home or you're pulled away for any other reason, rest assured that this is going to be recorded and you can access it through the RDH View website under the RDH View tab. So with that, I'm going to hand it over to you, Kathleen.
Thanks, Beth. Well, before we get started, I just want to say a nice happy birthday to Beth Parks, who is here with us today. How old are you today, Beth? Or should we not ask?
23. Oh, I'm 23 and no, it's
29 and holding.
Yeah, great age.
How did
Just loving it.
How did you celebrate? How have you celebrated so far?
Well, I was telling Carrie this morning, funny, it's very applicable to the topic today. I've had this repetitive injury on my ankle. So every time I've wanted to be a runner my whole life and I'm just terrible. And every time I get on the treadmill, my ankle sprains. And I thought it was from an injury from my early 20s. I'm still in my 20s, but earlier 20s. And I thought that's what it was. So I just got these shoes about a year and a half ago and was using them. And then I bought myself, because I thought, you know what, I bet you it's my equipment. It's my shoes. They're not good shoes. So like any good dental hygienist would do, I poured into the research for proper shoes. I consulted experts, and I got these shoes and I thought, this is the ticket. And sure enough, for the first time in a year and a half, I was on the treadmill today and I didn't sprain my ankle. So your equipment, your equipment matters.
Equipment matters, right? And that's
equipment,
what we're talking about today.
Equipment matters. They are from the running room. They're green. I can't remember the title. I can't remember what they're called. I'll come to you later.
That's awesome, because that's what we're talking about today with the fabulous Louise Tolan. I don't really have a bio to read off Louise, but we don't need to even introduce you. Everybody knows who you are. You've been a dear friend of mine for how long? Since the late 90s.
Yeah.
Long time.
Yeah.
Yeah, and with us, with RDHU, right from the beginning, when we were starting the whole, experiential learning, the tell, show, do, come to the facility and dive in. So, Louise, you are a master clinician and have helped transform the dental hygiene experience for so many dental hygienists, for their practices, for their clinician or for their clients. So So thank you for all that you do. We're thrilled to have you be a big part of our lives and to help educate and always inspire others. Yeah,
Well,
so we're
thank you,
looking forward
Kathleen.
to today. And so like I've known you for forever, and I remember you sharing something about you were injured years ago. So I thought we could just start today about talking about that. Like what happened, just maybe share that story with us to start.
Yeah, thank you. Yes, it was many, many years ago, a lifetime of practice ago. And I had been working in perio for many years. And when I got pregnant with Braley, who's now 30, that's a thought. I really noticed that my left hand in particular was getting really numb when I was working. And after he was born, I thought, oh, it's going to go away. It's probably just some pregnancy carpal tunnel. But then I also started to notice that it was also in my right arm. And that started to be a big concern. And as I tried to go back to work after he was born, I was really dropping things on my left-hand side, so much so that I would put a towel on the floor so that that mirror didn't bang around. And that got pretty frightening, I tell you. And it didn't hurt. It was just getting numb. And I didn't really understand what that was all about. So I regularly saw my chiropractor, but I had to increase my visits. And he told me right away what it was, because I had been seeing him and he knows what I do for a living, that he knew it was definitely an ergonomic situation. And I had compressed the blood flow and the nerves that run to my hand. So he very quickly made sure that my right arm was in okay shape and evaluating that, but my left arm, it was becoming a real big problem. So by the time we get to the fall of 1991, you have to understand like how we progress as a whole society. What was new back then was like 911 was new in 1991, 92. So, we didn't have a lot of the same type of diagnostics. And this was a really rare. And so it took quite a while before I found the right person that could refer me to yet a specialist. And to have quite a few tests done, lots of neurological and lots of testing to find out what was actually happening. And during that time, I had 2 little kids that I couldn't care for very well. And so it was a toss-up between trying to manage to get through a day of work and trying to progress to see different specialists and look after these 2 little children. So that's where it started. And I think that it was a really was a really trying time, and it's very challenging to understand that there were at that time only 2 people in all of Canada that really understood what was happening with my hand. So we'll look at that a little bit more closely because I think it's pretty underdiagnosed. And I kept being compared to a violinist. I think that they get this injury as well fairly frequently. And so we should be more aware of it. So it really changed our life as a family, and it changed my kids' lives because they had to accommodate to what I was able to do. It was not so great. Fortunately.
So you kind of said it perfectly when you were talking about just how things change, right? So this, I think I'm trying to remember that this was, you said 91, when this was when you were starting to see the specialists.
Yeah.
So getting to a diagnosis, today might be very different than in 1991.
Yes.
So can you talk a little bit about how you mentioned all the tests and things you went through, but was it extremely difficult to actually find a diagnosis at that point?
Yeah, it was. So let me just share some slides with you about thoracic outlet and what that involves, and then you'll understand better. And you'll understand also, probably need to share my screen. Talking and pushing the right buttons at the same time is interesting. So here we go.
Got a nice organized desktop there.
Yeah, it's got a lot of stuff on it.
I don't want anyone to find.
So thoracic outlet is a group of disorders, and it talks about the blood vessels and the nerves that fit between your collarbone and your first rib. And those nerves and blood vessels, they get compressed. And it can be from anatomical defects. For example, on my left side, one insertion of a muscle, I mean, we deal with that all the time, is in a reverse order. And so that made the compression even worse. And so you can have it from poor posture, which, wow, in hygiene, we might have poor posture, trauma, car accidents, repetitive strain for sure, pressure on your joints, and even you can see it in pregnancy. So once again, me thinking that maybe it was going to resolve after my pregnancy was a good one, but that's not what happened. So unfortunately, as you can see anatomically here, it becomes a real squishy site. And one of the things that that we need to be aware of is the scalene muscles that go down here, because we're used to palpating those. And these are major contributors to this situation. So if you are having massage therapy done for yourself, you need to make sure that they are really working those scalenes, because that will help free up this zone of compression and make sure that blood flow and nerve endings pass through more readily and more comfortably for everyone. So we can get tingling in our fingers. So thoracic outlet, the tingling is in your pinky finger, okay? And it can come up to halfway into this finger. So as I'm lifting it, it's really tingly right now. So it's very interesting to me, like even to this day, even though I've had surgery, I still have tingling. I have tingling all the time in my left arm. So I actually ended up having, it's called transverse first rib resection. So they actually removed my first rib and 3/4 of my scalene muscles on the left-hand side.
Now, are you left-handed? Sorry to interrupt. Are you left-handed or are you right-handed?
I am right-handed. So it's
your mirror side where we sit like this, right?
That's right. So we position our bodies, right, to our scaling arm, usually much better than our suction arm, right, in your mirror arm.
Yeah.
So you can understand, and then your left arm, for me, my mirror side, has to get there whatever way it can, right? And so what happened was, because in my day when I went to school, we didn't get taught ergonomics at all. I had my elbow up to try and get to everywhere I needed to be. And so the more you put your elbow higher than your breast line, the more you build those scalenes up. And then if you are find some impeding of that area, then you can see through this diagram how you can cut off the nerve and blood supply to your hand. So I was dealing with this in the fall of 91. By January of 92, my hand was shrinking. And I will show you when we come back off the slides, the different size of my two hands. So it became really important that we moved along and found out some resolution to that area. So I just want to go through a little bit of the signs and symptoms so you can get a bluish color to your hand because it's so cold. It gets cold. It comes on as cold and then gets warms up. And but when I finish for the day working, I keep something on my shoulder for sure to stay warm. You really got to change your mind about how you think of yourself and think of yourself more like an Olympic athlete. You just happen to do debridement for your Olympic event. And it's really important because you can't be like running out to go get a coffee. I mean, we wouldn't do that now anyway, but you know, it's freezing cold out. You need to keep those muscles that you've warmed up. You need to look after yourself. No Olympic athlete would just run out and go do something else without putting some warm, layered clothing on to keep those muscles protected after they finish doing a workout. And so we need to think of ourselves more like that in order to protect ourselves for sure. So I experienced definitely color change, weakened pulse, weakened abilities with my arm. So having it be cold and getting my under your nails end up being kind of blue from time to time, the tingling and the numbness. And I also get shocking pain sometimes from under my armpit that goes down my whole arm. And so you can imagine that this can be really debilitating, and you can't count on lifting anything above your head. So that really changed things in my life as well. But I just want to talk about carpal tunnel for a minute, because a lot of people experience that as well. And the differential between carpal tunnel and thoracic outlet is where you get numb. Okay, so where you get that tingling. So that tingling when you're talking about carpal tunnel is in your first two fingers, halfway through this one. Okay, so these two fingers are more a symptom of carpal tunnel, whereas your pinky finger is more like thoracic outlet. And so you can see that there is can be compression here of the median nerve, and you can have a release done in that area as well, which I also had done when I had my rib removed. They also did that so that at least my whole left side was hopefully going to feel some relief. But it did show up in the tests that I had that there was inflammation and increased fluid in the area of the median nerve as well. And so I had both surgeries at the same time. So it's a pretty big surgery. They go in under your armpit and they remove your rib, and they go in and remove all the muscle on the rib, and they sew it up because ribs can grow back.
Wow.
Well, so they thought at the time that they would warn me that I may have to have it done again. That's not an exciting thought, let me tell you. So I just wanted to show you, there was a recent study published in the CDHA journal, and it talked about surveys that we filled out as Canadian hygienists about all the different body parts that we could complain about. As you can see here, neck is like a biggie. And like I said, we have to look after those scalenes, because that's what, if you wake up in the morning and you've got an eyeball headache right here, that is relating to your scalenes muscles that are coming down the back of your head and splitting down here. And you need to get that looked after. So, and the way that we can see ourselves in this dynamic is going to show us where we're going to end up if we don't make some changes. So where do you fit in this whole situation? Are you one that is feeling that perhaps you could be ending up with carpal tunnel? And you can see down here in this tiny little spot, thoracic outlet. And I really think it's more because we we don't see the right type of diagnosis and the right people understanding what thoracic outlet entails. And so it took a long time before I met the surgeon that ended up removing my rib and most of my scaling muscles. And then after that, I still had residual pain. And so I was on amitriptyline for a while, which I really disliked for many reasons, but that just acts as a volume control. It doesn't do anything for the resolution of the problem. So I was still in search of trying to find a solution for that. And in my research, I realized that perhaps more poignant massage therapy was required. So there's a technique that was invented by Ida Rolf called Rolfing, and that's from Australia. There is a kind of a North American interpretation called structural integration. They're similar. So basically what happens, they look at the body in these 10 boxes, and they try and realign your body from the bottom up. So you start with your feet and ankles and you move all the way up. And they actually, it's pretty aggressive massage therapy. And you have somebody who's certified in this type of therapy. And they actually try and rip the fascia off your bone. So you're pretty bruised up. And what that allows the body to do is forget the memory of what it thought it was supposed to be doing, and allows it to reattach in a way that is more holistically minded. So that takes a number of months to go through that. And it's pretty serious stuff. So you have to be ready for it. When your treatment is over, I had to go to Waterloo to have that treatment. I couldn't drive for an hour because I just couldn't. It was too much. So it is out there, and that is what got me off medication. And that really changed my life. And I thought that I might have to do it again in my lifetime. And I would definitely seek someone out to try that. So if you're out there suffering, you need to investigate into that, perhaps maybe before you try a surgical intervention. But okay, so let me show you my hands. So this is, you see this hand, and you can see how thick this pad is here. And look at the other one.
Wow.
Yeah, so this arm was dying. So you can see that there was obviously a lack of nutrition and blood flow to that area, and it was shrinking. And so you can see that it's much flatter and thinner than this one. And it's not just because this is my work hand, you know. So because I get all my inoculations in this arm is never going to get any disease or anything. And it's generally a little bit tingly all the time. So it's a very special appendage.
Louise, can you remind us of the name of the type of massage therapy you went for? And there have been a few questions that have come in about tests. Like, I guess they're trying to figure out or get a different potential diagnosis. Are there certain tests they should ask for or ask out?
Yeah, so you need to see a neurologist, and they're going to do testing on your nerve endings, and you're going to see some vascular testing to check the blood flow. And so both, because thoracic outlet encompasses different types of syndromes, both you can have both vascular intervention and you can have a neurological. And so you might have only nerve entrapment rather than also blood flow, but I had both. I was doing it well. And so the surgeon actually said to me, if you didn't love your career so much, you probably would be okay. But because I was working and loving it, this is, the injury that happened. So that makes a huge difference when you're looking at what are you going to continue to do? What are you going to do you know, and I really wanted to get better, to get back to work. But by the spring of 2022, no, of 2092, and I had the surgery, but they put me on permanent disability. I was supposed to be done. Oh, nice. It was just
Perfect timing. That's it. You're done. The horn is gone.
Oh my God.
He's
Anna
anyway,
Louise,
yeah.
how did this really rehabilitation? I thought for sure you would have had your surgery, you have had a few months of recovery, and you would have been fine, because we're talking just a few years ago you had the surgery. So
Yeah.
what was that rehabilitation like? You were off work for a period of time, and then now still suffering from this. How has it affected your practice? Because clearly you've had to make some major changes in your practice. And in case anyone's wondering, I keep sitting up straight as she talks about this. I'm like, oh, I'm not sitting up straight. So I'm sitting here and I'm actually sitting on an ergonomic stool, but I'm like, okay, let me just make sure I'm sitting up straight, my neck's up and everything.
Is that the convoy passing you?
Yeah, no, I'm going to tell you what it is. The snowplow man is ticked because there's some people parked in the street.
Oh.
So I have no clue.
I just have to share, when I started dental hygiene, I started with 2 in casts. I showed up for my first day in school with 2 casts on my wrist. And they're like, are you sure you should be going to dental hygiene? Yeah, because I had tendonitis and that's how I started. It's like, hello.
Yeah, yeah.
It's bad.
So when after my surgery, that was considered to have like a 6-month recovery period, and I had disability insurance. I had, you know, Paul Revere, which in the day was like the best, and reporting to them became like a huge stressor. Like that was incredible stress. And so so I had to stop work in the fall of 91, and as I got better, they of course wanted me to go back to work. And there was a huge challenge between that and the fact that CDHO at that time, you had to practice 300 hours in order to keep your license. So there was that additional pressure. Holy cow, there was a lot going on. So by the fall, I had started with the structural integration, and I would go and work on Friday for like 1 patient a week. And in the fall of 92, but I was still in in the process of getting better. So as far as changing my practice, then I needed to really look at all of the equipment that I was going to be using, and in order to do that, you have to reimagine what you can do and what is going to be painful for you to do. So at home, the type of massage is called structural integration. Okay, that's what you want to go look at, and you can phone and talk to people at the alternative medicine sort of colleges, because they have to be certified. So you could phone the RMT college and find out someone in your area who is certified in structural integration. So hopefully that helps.
Like major lifestyle change for you. Like,
oh yeah, it was huge. Because for example, my kids were little, right? So I couldn't lift them up like this. So what I would do is get them to turn around, and I would scoop my hands under their armpits to lift them down from my big magic wagon, you know. And so that really, every aspect, I don't know what he
thinks. You never know when you go live what's going to happen.
Yeah, I know. Okay, he's going back up the street now, but he's not happy with all the people parked on the street.
It's frustrating for them.
Yeah, it is. So anyways, but we're all in our driveway. So when I was working, I had to continue to make big changes. Okay, so like everything that you think like flour and stuff and sugar that's in your top, I have to put in the bottom. because I don't have control to lift it from the top down. Okay, you have to lift heavy things from the bottom up, because anything that gets over here, I have less control this way for both of my arms. So my pain on my left still exceeds the pain on the right. So I've never had any surgery done on the right, but it really benefited from the structural integration treatments and ongoing massage therapy.
So do you still make those types of accommodations, like for your everyday living?
All the time. That's permanent. Yeah. I have fortunately, now that the kids are grown, they know that there's certain things I can't lift because I don't have control over those things.
You just have to swap your displays here, Louise.
Beg your pardon?
You have to swap your display.
Oh, I'm sorry. Thank you for sharing that.
Louise, it sounds like there was a lot of, changes, like the considerations you're just talking about. And so many people here are contributing experiences that they've had. So I think you're naturally going to be doing it, but we were just wondering if you could talk about some of the changes that you made in your practice to help you with the condition.
Well, yes, thank you. Yes, it is challenging to decide. You have to make some changes, and I definitely wanted to make sure that the changes that I made were going to allow me to practice, because up until this point, they said that I wasn't going to be able to practice anymore, but I loved it too much. So I was determined to find a way. So one of the things that I can't stand is vibration. That just drives my nerve endings crazy. So the first thing I had to do was change from Cavitron to piezo, which ended up being a godsend in disguise, because we had a piezo at school, and I think we got to use it for all of like 10 seconds. We weren't really taught how to use it, but I needed to have something working in perio, and I couldn't stand the vibration of the Cavitron. So learning that the piezo moves in a linear fashion, and that the crystals in it expand and contract and make that linear motion like a scalar, a smooth process for both myself, and for my client. Was an excellent career practice booster. So I learned how to use a piezo, and I've been a piezo user ever since. And for that reason, I was motivated to make that change, because I couldn't tolerate the vibration in my right hand, which I was really desperately trying to protect, not to have the same full-blown problem that I have on my left-hand side. So that is one big change that I have made and stuck with, and certainly made sure that I utilized. And so the next thing you have to look at is our armamentarium. So we have to look at the way that we choose our instruments. And I can imagine that perhaps some people are going to say, I don't have control over that. Well, if you want to work, you got to take control over that, unfortunately. And so, when Kathleen and I started working, the diameter of instruments was like an HB pencil. They were extremely thin. And so trying to hang on to them is challenging. And so when you consider what we do with our left hand, even where we're thinking, okay, scale with this hand. And by the way, hold on to the mirror with this hand, right? While I'm scaling. And so your brain is having to work at that. So by looking at the diameter of all the instruments that you use, you should be looking at making sure you have the best diameter, the widest grasp that you can have, because that allows your hand to relax a little bit more. Having a nicely weighted instrument, pardon me, and I'll have a sip of water there. is also really important. And making sure that it's well balanced, and the use of the instrument has good tactile sense, so that you can feel at the very tip of it if you're on that piece of calculus that you need to remove, or that accretion or that cement that your dentist never leaves behind, right? And that we have a proper shape for that instrument. Does it look like its intended shape? Has it been kept through the aging process? Has it been altered? And so now its intended use is not absolutely correct, but is the shape of the instrument and the design of the instrument, are you using it appropriately, or are you putting too many demands on an instrument that shouldn't be used in that location or for that purpose? The shank, is the shank thick enough for what you're trying to do? Do we want a longer shank because we're working on a stage 3, 6 millimeter plus pocket? We need to make sure that we got the right equipment. And then when you're putting that force on there, do you like that sturdy force, so that you can, hopefully pop off? I mean, that's the ultimate goal, that we could pop off some accretion. Or do you feel that your instrument, do you like to have that resin feeling? There's lots of options out there, but you need to find out which one is really the best for you. And then, of course, sharpness is always important. If you're working with dull instruments, that's just not, it's not friendly for you. It's not friendly for your client either, right? So we need to make sure that we're looking at each part of the equation. And when we're looking at what a big part that instruments play, and certainly have played over the past 2 years, we need to make sure we got the right equipment. So one of the great things that Hugh Freedy has done is they've really gone with third-party testing and collaboration to look at how we work with our clients when we're actually creating that force, and how that would contribute to cumulative strain injuries. So we can see here this clinician is all hooked up, and they've got all these points that they have been educated in what type of force we use, how we use it, and then enjoying the information that they've gained from that. And that allows them then to create the way that that they created these new instruments. And as you see in this picture, maybe it's a little bit too small for you, but you can actually see this clinician as it changes up here on the dashboard, the force that's being applied in order for them to be able to create that scaling stroke. And that allowed them to create this true fit technology, which then gave them the information that they needed to make some really great improvements ergonomically to their newest instrument design, which is amazingly helpful. Because as you know, more than 70% of us experience some sort of hand, wrist, arm pain. And we're going to see that continue for as long as you're working. And as you know, we all work longer than we used to. So this new design, it created this new ergonomic feel. And I can tell you that the serrations being deeper have allowed me to roll my instrument better, feeling the firmness in the hand better, and reducing that pinch force has been really important. And then reducing the pressure that has to be applied to the tooth is really great too, especially when we're spending a lot more time working on the areas of root surface. So when we're looking at these new designs in all instrument classifications, you have to look at, when they are designing them, what is their goal here? And fortunately for us, Hugh Freedy's goal has been to elevate the ergonomics for the clinician. and make sure that that we are able to enjoy a long career supported by well-balanced instruments that have a reduced pinch force, and they have great threads so that we can rotate those in and around and adapt better. The other parts we need to look at are bad technique, issues, and that is going to be when you've got your hyperflexed thumb, for example, and that could be a problem. So these are technique issues that we deal with in our elevating instrumentation session that is at RDHU, and those people who come in and they got their little finger up and they're like, I call them the teacuppers, and this is big stress on your hand to have it like this, and you'll be amazed at what can happen if we can get that corrected so that you are more comfortable and have a more relaxed hand so that you're not as at risk for injury.
At our office, one thing that we've done, like when I say our office back in the day when I was working with my dad and he owned his practice, if we were not sitting correctly, we would walk by and correct the hygienist. Like if we saw their elbows up, we would sort of remind them. And the same thing is if they were helping us with our probings, they would watch our stature and they would say to us, like, are you on, like, is there a reason you have your death grip on? Like you should have it relaxed. And these are the little subtleties that you can talk to your team members, especially if you're experiencing pain, because they can help you with this for sure. And sometimes you're not even aware that you do it or the way that you're doing it, because it's just the way it's always been. But definitely adjust your height, adjust your patient, and look at your hands and your technique, because it will make a difference for your patient's experience. And also it's going to make a big difference because you have to live with your body and the repetition injuries. I don't know, Beth or Kath, do you have anything else to add to that?
No, but actually I do. I shouldn't say no and then keep talking. No, I was going to say, like, what reminds me of, like, when I was young, and Louise, you're close to my age, like, we were forced to hold our pencils with a modified pen grasp. We weren't allowed to have, I see a lot of the younger dental hygienists with this flexing of the thumb when I'm helping them sharpen, and that I see a lot of, like, how do you hold your pen? Oh, that's not, like, we were trained, you have to hold your pen like that, or we get like a little ruler on our hand. I don't know if you experienced that, but I did. Like, we were trained to hold it like that. So, but I'm seeing a lot of the younger dental hygienists now with that more, they don't hold it like we do. And I think where you get the other.
The way to protect your working hand is to make sure it always looks like an O, right? Because that is, if it's flattened, then that's going to cause injury. Yeah. So you need to be in your O, right? And you can't do that, because where my next point was, is you can't do that if your gloves are too tight, okay? Mm-hmm. And that's a big problem. People wear gloves that are too tight, and it's not like compression stockings that it's good for your health. It's not like that. You need to have room to be able to use the lever, and you can only make a lever when things are bent. So having gloves that are just painted on you and you can see every little fat fold that I got in my fingers is not the way to be. You need to have room in those gloves.
I'd like to be a small. I do want to be a small, okay? So I have an envision and I have a goal to be a small, but these hands, this part does not fit small. It's way too small here. And my patients always laugh. They're like, your gloves are so big. I'm like, well, they have to fit my fat hand and my short fingers. So gloves, you have to figure it out. But yes, fit what works, because otherwise by the end of the day, your fingers are hurting you and you're not happy when you get home. That's for sure.
Yeah, we don't want to see finger scaling either. Like we sometimes see in some of my sessions that people are finger scaling, and you need to make sure that you're using that arm and your elbow and your shoulder, and it needs to work all as a unit, like rotating, get that rocking going, because then that's powerful. If you're doing it this way and you're doing little digging, this is not powerful. And this is how we get injured. But we need to make the right choices. And so those continue to be even with instrument selection. If you're looking at what you should be using. Sickles are great for breaking through supragingival calculus bridges, and they're great, yes, for going in between. If they are like stage 1 or kids, that's fine, but you need to use a universal curette in order to be able to get out ideal results with your debridement. And it will treat the tissue as well, because there's 2 blades, right? So on the inner blade that's on the tooth, and the outer blade is treating the tissue and removing pathogenic material. Gracies then are the follow-up, and that is for finer work. It is not for pulling out first and starting with those. So if you use and you make instrument selection with the purpose, with the expected outcome in mind, then you will protect your hands once again, because then you will know that you are moving towards protecting and being effective. So you're protecting your body, you're being effective with your client, and you're also protecting your client from misuse of the wrong tool to do the right job. So we want to make sure that we are using those correct tools, and that would include using longer shanks and smaller blades to work in tinier places. So then you might end up having also specialty selective instruments, like to work in furcations and in other tight spots that you need to work. And so we need to have a wide selection of tools. No one expects and should expect that a hygienist works with 3 scalers. You can't do that. You're not doing the best job, and you're hurting your body. So if you were to decide that, I don't have a good complement of instruments to use, then first of all, come to one of our RDHU classes that's live, so you can actually feel and try different instruments, so that you can learn their purpose and expected outcome and make good judgment calls. And then you might have to set aside a little pot of money to decide, I'm going to buy 4 of these instruments for this year, for 2022. That's going to be my goal, is to implement, a Barnhart 1-2 or a Young or Good, and implement it to your practice and see what a difference it makes. And then if you're not spending extra money going to the chiropractor, going to massage therapy, because you've got the right tool for the right job, then you're actually in money, right?
I really challenge all of you watching to really look at what's in your toolkit, because if you haven't met me before, I'm slightly structured, okay? I really like my routines, and I really appreciate some of the new graduates that I've had a chance to work with, because they were taught on some very different instruments than what I had been taught on 20 years ago. And sometimes I'm like, what do you mean you want this? How does it work? I look at it and I'm like, I don't understand. And I've learned so much from trying different things. So we are stuck in our ways, and we love we love this universal, but maybe that 1-2 Bernhardt is an amazing instrument. Honestly, it is so nice, and it's got a good structure, but I do challenge you to look at your kits next time. If you're ever at a live event or you're at RDHU and you're live, look at all the instruments that are there, talk to some of those reps, because there are some really great options out there for you.
Mm-hmm. And Louise, when you were talking about all the different aspects of the instrument, what to look for, one of the things that I wanted to say is, like, you have to never compromise, because I feel like so many people compromise every day. And it's like, oh, I'm using instruments that we bought 8 years ago, or I haven't got new instruments in 3 years. If you're compromising once, you're going to keep compromising. And then that once is going to come to the next day, the next week, the next month, the next year. And you're going to just get all these cumulative effects on your body. So I'm one for, like, check out what you have, don't compromise, invest in yourself, and buy your own. Like, if somebody's not going to buy them for you, then you buy your own. And you have, even if you have 5 kits, right? And nobody touches them, you say, these are mine, do not touch them. And they're going to last you longer if no one else is sharpening them, no one else is using them, you're using your ultrasonics. It's like, you have to invest in yourself. You have to take care of yourself. If you're not supplied, invest in yourself. And speaking of self, I want to talk about self-care, because I've seen some people ask about any kind of exercises or anything that you would recommend, Anna Louise, to help prevent these things to happen, you know, to our bodies.
Yes, there are some really simple exercises. There's 4 little ones that you can do, and you can do this in between clients. So let me just quickly share those with you so that you can take maybe a screenshot of them. So here we go.
Somebody also asked for your slides, but perhaps we can even, it's going to be recorded, so we will have it. Then you can always go take pictures of the slides as well. But just so that you know that, Anna Louise, people are loving your slides.
Oh, thank you. So let's all try this one together. grab your finger and like and one by one, and you are going to put your hand at the base and stretch it back. Okay.
You just have to swap your display again, Anna Louise.
Oh boy. It is tripping me back.
Friday, TGIF.
Yeah, there we go. And now it's back to the way it was before. Silly. Perfect. So, okay, so everybody grab their fingers and stretch those back. Okay. And then we're going to do all 5 together. It's the high 5. And then switch to the other hand and just say you do it for 5 seconds and hold. And 5 seconds and hold. Okay. And then the next one is the prayer. Okay. So you're going to put your hands together. All right. And you just let it go. Have a good shake and then do it again. Make sure your hands are lower. Okay. And then the last one is just to open up that carpal tunnel area, and that feels so good, right? 10 seconds, just increasing circulation.
How often do you do this? Do this every day? Or
yes, every day. Every day, and in between clients at lunchtime for sure. While I'm standing in front of the microwave waiting for my soup to warm up, then all of a sudden you've increased that blood flow and allowing it to deal with any inflammation that is in your hands. And that's why you do that one last. Okay.
Yeah, that feels good.
It does feel good, right? So just those 4. So my goals for everybody here before I just take any questions is let's decrease the propensity for which you can achieve or I want to start that again. We want to decrease our propensity for injury. And so the way we're going to do that is really look at all of our equipment. And maybe we need to really think about it as being an equipment mind change, right? We need to really evaluate our equipment and decrease our muscle fatigue and be very aware of what's happening to your body and think about treating yourself like an Olympic athlete that you are, and keep your muscles and everything warm, and making sure when you come home at night that you are actually putting a pillow underneath that arm that works so hard today and allowing it to just sink right into the pillow, so you're not actually in a static hold of that arm. You're just allowing it to relax. Okay. And hopefully you can increase your career expectancy by doing all of these things, of looking at your equipment and making better choices. One of the really great things that you might consider is Hugh Freedy, and thank you, Hugh Freedy, for sponsoring this session today. Is Hugh Freedy has a new Environment program, and you can Google that. And if you get 12 old instruments, they don't have to be Hugh Freedy, and they're recycling, and you get them to your Hugh Freedy rep, you can trade them for a Hugh Freedy instrument, and that includes the new Harmony ones. So you have to fill out a little bit of paperwork, but it is there for you. So reach out to one of your HuFreedy reps and get those 12 instruments together, sterilized in a package, and fill out the paperwork. And you can try out a new Harmony instrument on HuFreedy. So that's kind of nice.
Sorry.
Go ahead.
I was going to say one of the nice things about the Harmonies because of that shape, right? And
yes,
years ago when we practiced we would say swap up your handles. So you have a number 6 and a number 4. So that would be to swap up the grip, right?
Right.
So with that shape, that's what you're getting. You're getting that swap of diameter.
That's right.
So you're giving your hand a little break. Yeah.
Right. And the EverEdge technology too is the one that is on the Harmony as well. So just know that that you are in charge of your own outcomes. You have to listen to your body. And I'm happy to say that I did get back to working 4 days a week. It took almost 10 years, but I did. I was back working by 2005. So from 1994 to 2005, it took to get to 4 days a week. And now I'm actually going to be stepping down to 2.5 days because I'm doing more educating.
Yay.
Yeah, well, at this point in my lifetime, I need to share all this information because it helps my colleagues, and I appreciate all of the loving support that I get from my colleagues when they tell me that they've learned and they've improved their practice and hopefully help prevent injury and do a better job, right? We all want to serve and do a better job for our clients.
Anna Louise, we've had some really awesome comments. I did put the link for the HuFreedy recycling program in the chat. If you're looking for it, it is there. I know there are a few questions, and I wasn't sure if you also have any exercises for stretching legs or chairs or anything else, or not at this point.
Well, I didn't bring those today, but
okay.
if we can look into sharing those.
Okay, no problem. Someone wanted to just know, and I thought this was kind of funny, since your arms were sore, did that mean you got up doing dishes? So, I'd hope that yes, in some ways, or you had to be very ergonomic, stand on a stool so you could reach the sink a little bit easier, but.
I get out of scrubbing everything.
Yeah.
I don't scrub anything. If something gets caught on the bottom of a pot, not my job. And so anything that I do has to be like lower. So I'm okay with doing jobs, but it has to be basically from the floor to, basically my waist. So if it's above my head, it better be light because it could fall down.
Okay.
Yeah.
A few people were asking, and I think you mentioned it, the type of massage therapy that you received when you were talking about the fascia. What was the name of that again? It's called
structural integration. And you can read about Rolfing because that's where it started. So that started in Ida Rolf. She's a nurse from Australia, and she really brought that technique forward. And of course, once it hit North America, they needed to have their own version. So it's like, two schools of thought. So
yeah,
that's awesome. Well,
and when you were talking about, one last question, when you were talking about the piezo versus the Cavitron, for your specific situation, it was the vibration was bothering you. Was that correct, or was there something else that you had said about the difference?
So the handle itself, it doesn't vibrate. So it's like holding an instrument, whereas the Cavitron, everything's vibrating, right? And so it was for my comfort that I changed, but of course the clients benefited from that as well. So we have a day at RDHU where you can come and try out piezo, and that's going to be coming up this year as well. So look for that.
I was going to say, you must love the IO power brush because
I do.
Hardly,
because it's magnetic. It doesn't have any gears, so it's super smooth. Yeah, I'm all about smooth driving, whatever it is, whether it be a car, my toothbrush, or ultrasonics. I'm into it.
All right. So just to let everybody know that we have an online interactive sharpening course on Friday, February 25th. So that is online. So it doesn't matter where you're from, you can join us on that. And then we have Anna Louise at RDHU for Elevate Your Instrumenting. And that's that'll be our first full live course back at RDHU. So yeah, we invite you to join us. It's limited attendance. So if you do want to spend the day with us, please register as soon as possible. And yeah, that was fantastic, Anna Louise. Everybody, we got some really great feedback and chat, and yeah, so thank you for sharing that with us. It was awesome.
Thank you. And we get to use and try out lots of instruments, more than 25 at that particular program. And I'd like to thank Melanie at Hugh Freedy for making us flush with instruments to be able to do that, and for supporting us today.
Yes, thank you, Melanie. And Hugh Freedy.
Thank you.
Yes, thank you, Hugh Freedy Group, for creating and implementing lots of great stuff for hygienists for us to continue to work as we do.
Now, before everyone logs off,
lots of-
Beth, do you want to just let people know how they can get their certificates? And Anna Louise has also provided us with Hugh Freedy as well some follow-up resources. So there'll be some additional things that are coming in, and we will make sure, Anna Louise, if you can send us the stretches maybe, and that way then we can include that. Beth, how do they get their certificates? Can you remind people, please?
Absolutely. So you will be, actually, you know, Kathleen, I'm going to let you take over that while I just answer a couple of these questions. Thanks.
Perfect. Yeah, I was going to say that. So what we're going to do is it's being recorded. So we'll upload it into the personal portal. It's members.rdhu.ca. So you'll all get it in that portal. And then with that, we'll have a short quiz, and then your certificate will be on there. And I'm thinking that maybe we're going to change the name of today to something more about instrumentation, so that our some of our members can use this, because we talked, a lot about instruments versus just on ergonomics, right? So we can't really claim ergonomic hours, but I feel like talking about the instruments, talking about piezo technology, that I would be happy to give that title at like a different name, and then you can use it for your non-goal hours, or if you join Anna Louise for the instrumenting course, you can use it as additional activities. Okay,
perfect. That's a great idea. I like that.
Mm-hmm.
Yeah,
thank you so much, Anna Louise. Just so many comments. I think that this is just a topic that resonates with all of us, right? It's something that we've all been kind of nervous about. Our bodies are, what we do is very dependent on our physical bodies. So I think this was just a topic that everyone was very, very grateful that you shared all of this information with us, especially your personal experiences. So thank you very, very much.
Oh, thank you. I'm glad to get that out there, because I'm hoping that a lot of people can make good use of it and hopefully prevent some injury, or figure out, if you're uncomfortable, how you can be more comfortable.
Absolutely.
I just have somebody who says, if you're not a member, basically you're here today. So we move you over to the RDHU if you found us through, a different link. So you are a member, you're here today, it's free. So yeah, we will set you up. You will have your own portal. All right.
Oh, that's so great news. Thank you so much, ladies. Great session today.
Beth,
nice hair.
Thank you.
I was waiting for some comment about hair.
Thank you. That's very nice of you.
Everybody. We just love doing this. So thanks for joining us.
Yeah.
Have a great weekend, and we'll see you next month.
Yes. Take care, everybody. Be well.
Bye.
Bye.